Hi, my name is Edith Cuevas and I'm a licensed professional counselor. February 9th through the 15th is Children's Mental Health Week, and so I thought it would be helpful to talk about the three most common challenges kids face. So number one, it would be anxiety. So how does anxiety show up in children? What you're going to see most likely is problems sleeping, problems eating, excessive fatigue. If they used to be very active children, you're going to see changes in the behavior. So that's one thing that I always recommend in parents, is that to observe what you know your child normally does. And for a child, it's normal for them to be active, playful, wanting to be outside, running around. When you see a child sitting on a couch, doing nothing, that is always like something that comes to mind, that I think something is off with one of my kids. So anxiety is a big concern with kids, avoiding, right? So all of a sudden they don't want to go to school. When they're about to eat something, their stomach starts to hurt. All of those signs are signs that your child might be having some anxiety issues. Number two would be attention deficit disorder. There are two types. There's the hyperactive type and there's the focus type. So the hyperactive is just what it says. Kids that just can't sit still, right? They're always moving, they're always shaking. They're sitting in their chair and they're always, they always have to be moving. It's very hard for them to sit through like an entire movie. If they're sitting at the table, they're getting up all the time. So those are signs of the hyperactive type. The focus type is, they're daydreamers, and they'll be working for a while, and then all of a sudden they will just go off into their world and lose focus, and then they don't complete activities, they don't complete assignments, they have a hard time with organization. So what can you do to help? Kids with ADHD, one thing that is very helpful that I think is a really good place to start is structure. Adding structure to a child's day. Adding routines, putting routines in place, putting signs up for them to remind them so that way you're not after them and they don't feel nagged all the time. But order is one thing that is very helpful. Minimization, decluttering of their environment is a number two. Kids with attention deficit disorder, the less number of choices you give them, the more helpful it is for them, right? So instead of asking them, out of 5 shirts, which one do you want? Reduce it to 2. These are your choices, which one would you like? That way they have some control over the situation, but it's limited, it's structured, right? So structure and decluttering are two things that are super helpful with ADHD. Depression. What does depression look like with children? Lack of activity, inactivity, isolation, sleeping, oversleeping, not eating. You can see sadness in a child's face. Anger. Sometimes it may not be sadness, but it might just come out as anger. Talking back, fighting with their siblings or their classmates. What can we do to help that child is trying to connect and finding the association of what might be going on. So connection would be really helpful. Giving them an open space to be able to talk about things. And so this is, with depression, I think, is something different, because it's hard for the kids. Kids are not going to have the vocabulary to say, I'm depressed. They might just be acting out. And so, but you as a parent, if you see that the behavior is very different and you have tried to talk to them and things are not changing, they're either getting worse or it's spreading into different environments. So now the anger isn't just at home, but at school. Maybe it's a good idea to look for some professional help. And play therapy is very helpful. Having somebody outside be able to tune in, that's what my recommendation would be. I hope you found this video helpful. If you liked it, put like on the video and follow my YouTube channel, and you can subscribe to my newsletter on my website. Thank you.